When considering hormone optimization or treatment by a functional medicine specialist, patients often ask, will this be covered on my insurance? I'm Steve Goldring from simplehormones.com. I help patients and healthcare practitioners with easy-to-understand patient education resources. Most of those resources are about hormones and hormone optimization. Our healthcare system is based on third-party payers. Health insurance companies, Medicare, or Medicaid are primarily who pay directly for things like doctor's visits, for lab testing, for prescription drugs, for surgeries, and just about any other medical procedure or medical service. Well, a third party adds a huge cost to any transaction between a patient and a provider. Third parties also take a huge cut of any of the money that gets exchanged between patient and provider? Well, the answer to that question depends on a number of different factors. It may be no, but it might be helpful to step back and ask a few different questions, like how much time does an insurance-paid practitioner or primary care provider have to spend with me? According to several recent surveys, the answer is maybe 13 to 16 minutes. That's the average visit length for insurance-based family practice providers. A functional medicine practitioner is usually willing and able to spend more time getting to know you and getting to know the root issues that concern you. Question number 2, who has your health and wellness as their top priority? Is it that corporate system in the healthcare insurance company? Think about the multiple layers of high-paid executives and middle managers. Major insurers, they're all publicly traded corporations. Their primary objective is profit for their shareholders, not your health. Where's the transparency? When you get an explanation of benefits, it's called an EOB from an insurance company, is it really clear how much your provider visit or that procedure actually costs or how much the provider was paid for it? What's the total cost of your healthcare? When you look at the total, you really need to include your health insurance premium, whether you paid that or somebody else did. You'd also have to include your yearly deductibles, your copays, your out-of-pocket maximums, something called donut holes. In answering this question about total cost, you'll probably have to look back at that last question about transparency. It's not always that easy to tell what the total cost for your health is because there's very little transparency in most healthcare, especially health insurance. Well, I personally pay myself for a bare minimum health insurance plan. It doesn't cover either of the two functional medicine and hormone optimization providers that I see. It doesn't cover any of the hormones, the supplements, the other treatments I receive to help me optimize my health. My wife and I have budgeted 14 or 15% of our monthly income for health and wellness because it's that worth it to us. We really want to keep our bodies and our brains healthy for the long haul. In the 1st century BC, the Roman poet Virgil is quoted as saying, "Health is wealth." Well, who can you trust with your health? If this video has been helpful at all, click the like and subscribe buttons and click the little bell to make sure you get notified anytime I post a new video.